Hi, my name is Caitlin Lee, and I will be discussing my intervention on the impact of violence exposure on Black American minors in Camden City, New Jersey, USA. The people or community that this intervention will be based around are Black American males that come from a low socioeconomic status and who are previously exposed to violence from early childhood. The environment would be located in Camden City, New Jersey, USA, with a mix of suburban and urban neighborhoods that also consists of many public facilities, especially schools. The health or behavioral issue, or the main 3 points of it, would be that the forms of violence can definitely vary from physical to mental health or even beyond that. And the results of this health issue can also lead to death, injuries, psychological impacts, and more. And that it is extremely common among young ages, specifically adolescents. So the top 3 researchers with supportive information and research for this intervention would be these 3 listed below, who are part of the American Journal of Preventive Medicine. They released or published a research article about male adolescents' gender attitudes and violence, and the implications for youth violence prevention. And all 3 of them work out of the University of Pittsburgh. So this intervention is mainly based on the prevalence of bullying, as bullying is one of the main sources of violence, whether it's physical, mental, or through the internet. Stopping violence at its source of bullying will help prevent and decrease the rates of violence, especially among adolescents. And with the help of stopbullying.gov, this intervention would focus on the younger population of this community, mainly the adolescents in schools. It would engage the schools and staff in incorporating informative assemblies, activities, events, and more. And this information would then be shared with the parents and the other community members through emails and advertisements. Although this program will be directed towards schools, anyone in the community will be able to participate in it and in its cause and benefit from its information. The 3 main benefits of this intervention would be that it will teach kids the importance and benefits of not bullying and being respectful. It allows for a more interactive, rewarding, and overall engaging way of teaching adolescents about important causes, and ultimately it will lessen the rates of violence caused by bullying. Further support can be seen within the research and information provided by the CDC. So this intervention, as seen, can be well supported by many sources, such as the CDC. They explain that bullying is constantly repeated more than once and causes harm and distress to the victim. And working towards stopping bullying can help reduce the risks of violence. With this program, this can be done mainly through learning the warning signs of violence and the cause and effect that it can have on humans in general, especially when adolescents can learn this information at a young age. One of the main sources of violence may be stopped. As for marketing, this intervention, I would market it through producing flyers and sending emails to the community and parents of students. These advertisements and emails would consist of the activities and events provided by this program and how they could benefit the children of this community. And lastly, an appropriate evaluation process for this program would be the summative evaluation process. This is a form of assessing the effectiveness of the intervention after the implementation by looking at its outcomes. I would be able to compare and contrast both outcomes from after the implementation of the intervention and prior to it. And this will help track the changes in behavior and skill. And if the community and groups are positively impacted by the intervention, there will be a change in violence rates, meaning they would decrease. And many schools will also have implemented this program. Overall, this evaluation process or method will allow me to reach the intended outcome or if the beneficial changes are met. Thank you for your time.